By now, most of us have used or at least heard of AI tools like Copilot, ChatGPT, and Grok. Today, I'm excited to introduce the next big leap in EMS documentation at American Ambulance. It's called ImageTrend AI Assist, and you will have access to it on your next shift. Before I get into showing you how the program works, I want to go over some of the key features of AI Assist. Number one, we're going to drastically cut down on the time it takes to document an EPCR. We can eliminate the need for typing your narrative ever again. We can input procedures and medications using your voice, all hands-free. We can take a picture of a face sheet, medication bottles, or a Zoll monitor screen, and to have AI fill out the fields for you. There's a whole lot of ways that we can use AI to make documentation faster, but let's see what ImageTrend has put together for us. AI Assist will be added to the same EPCR you've been documenting on. The first place you will find AI Assist is on any screen in the EPCR on the blue buttons. If you click on AI Assist, this window has a couple of options. I can click on Record and input patient information like name, age, date of birth, history, medications, allergies, even things like treatments, medications. Let's click on Record and see what it can do. I have a 39-year-old male named John Doe with a date of birth of 5/9/1986. The patient has a history of diabetes and hypertension. The patient takes metformin, insulin, metoprolol, and the patient denies any medication allergies. If I click on the Stop button, it's going to show me what I had just voiced. And then if I click on Generate Values, it will try and extract any field it can. So here it took the patient's age, their medications, both insulin, metformin, and metoprolol. It brought in his date of birth, name. If I click Apply Changes, I can go to the patient section and see that first name, last name, date of birth, age were all brought in. The patient's history, medications. The next thing I can do with AI Assist is input treatments with my voice. At 18:55, I placed an 18-gauge IV saline lock in the patient's left AC. I also placed the patient on oxygen 6 liters per minute via nasal cannula. Click on Generate Values. At 18:55 today, I placed the patient on oxygen, nasal cannula, 6 liters. If I click Apply Changes, I can go to Treatments, Procedures, and also Oxygen. And you can see oxygen, nasal cannula, 6 liters was put into the correct fields. The next exciting thing AI Assist can do is use the camera on your tablet to have AI help you fill out your PCR quicker. So if I click on AI Assist and then Add Image, I'm going to use pictures that are already uploaded to my PC, but you can use your tablet camera. So we do run a lot of transfers here. You get a face sheet for that patient. We'll bring in this face sheet, and AI Assist will help me fill out all of the fields it possibly can from this face sheet, including the patient's name, address, date of birth, social, medical record number, and insurance information. If I click on Apply Changes, I can see that the patient's information has been put in. If I go to billing information, the patient's billing information was put in. Let's try one other image. So if I click Add Image, let's bring in this Zoll monitor picture. So let's say you get to the bedside on a transfer, and the patient's on the monitor, on the hospital monitor. Take a picture of that monitor and grab a set of vitals. So this brings in the time that the vitals were taken as the current time that was on the monitor, blood pressure, pulse ox, respiratory rate. I click on Apply Changes. That will be brought into my vitals section. Next up, if you go to the narrative section, right above the narrative, you will find 2 new buttons, a Record button and a button that is called AI Generate Values. So instead of tapping on the screen or trying to find a keyboard to plug in, you can now dictate your entire narrative. And since this AI was built by ImageTrend, designed to understand medical terminology, you can use medical terminology like COPD or AFib, and the AI will understand. But it also filters out other noises like Met 11 radio or your partner chatting with the crew next to you. So here's an example of how it would work. If I click on record, Medic 155 arrived on scene to find a 55-year-old male with a history of STEMI 1 year ago, presented with acute chest pain that began previous night. The patient described the pain as consistent with his prior cardiac episodes, rating it a 10 out of 10 in severity. Patient denied nausea and shortness of breath. On arrival, vital signs were stable. An 18-gauge IV was established in the left AC, and oxygen was given 6 liters per minute via nasal cannula. A 12-lead EKG revealed STEMI, The patient was given 162 milligrams of aspirin orally, a sublingual nitroglycerin tablet, and 1 inch of nitroglycerin paste was applied. The patient was transported code 3 to Community Regional Medical Center with no changes noted en route. If I click on stop, it will generate. And as you can see, it brought in my narrative. You'll need to read through this and make sure that everything is correct. And then, if I click on AI generate values, it's going to look through my narrative and try and fill out any of the other fields that it can. So vitals, treatments, medical surgical history, where we transported the patient to. If I click apply changes, destination is in there now. My treatments are in there, aspirin, nitro paste. A few tips and reminders before I leave you. AI Assist is still in beta test, so double check your narrative and other fields to ensure accuracy. You're still responsible for what AI Assist puts in those fields. Not every field in ImageTrend will be available for AI Assist to find and use, but this number will expand over time. When using AI Assist, be specific and give context. So instead of saying adenosine 6 milligrams, say patient was given 6 milligrams of adenosine rapid IV push. That should help AI Assist figure out what you're trying to say. AI Assist can fill in pertinent negatives, such as patient denies medical history. And then lastly, if you find a treatment or medication that does not work, please let me know. I'm excited to roll out ImageTrend AI Assist to the field. Please dive in, get creative, and let it help make documentation faster, easier, and maybe even make documentation fun again. Thanks for all you do, and be safe out there.